Hello, my name is Kate Richards, and this is my oral presentation of my research proposal. It's called I'm Not Putting On That Floral Gown, the Experience of Breast Chest Cancer for Transgender and Gender Diverse Patients, and it's a mixed methods study. So this is just the agenda. I'm going to talk about, just have an opening, talk about the background, methodology, data collection, interpretation, timeline, and then a conclusion. So first of all, that says take a deep breath. Cancer can be challenging, so let's all take one together. So just a couple definitions really quickly. So I'm using the term breast chest cancer to be more gender inclusive. I'm talking about what is commonly called breast cancer in our culture. The term chest cancer, while that would be inclusive of genders, it's actually already a term used for chest wall cancers or lung cancers. So in order to avoid confusion, I'm saying breast/chest cancer, which I've also heard other people say. So it's more inclusive, gender inclusive, and it's just starting to be used. So hopefully it can be used more often, and that'll catch on. And then for transgender, gender diverse, I'm going to be using the TGD a little bit to abbreviate that, but I'm using this term to refer to any individuals who do not identify as cisgender and within the typical gender binary. So that includes transmasculine or transfeminine, trans, gender fluid, non-binary, other gender expansive individuals. And how I came to this topic. My own experience with breast chest cancer started with my diagnosis in March of 2021. 6 months after losing a very close friend to the disease, I was at her bedside the day before she died. And the pandemic was a super lonely time to go through a diagnosis, surgery, radiation. And like, for example, I couldn't have anyone sit with me while I had my chemotherapy, at the hospital. I found that going through cancer really affected my identity in profound ways, and that is not a unique thing. That happens to a lot of people. But I was just really surprised also by the level which I felt further isolated due to mainstream cultural elements of breast cancer, such as the pinkness, girl power, flowers, etc. So I was assigned female at birth, and I'm non-binary. And even though I'm often femme presenting, this gave me some feelings of dysphoria going through this. I'm at one place on the gender spectrum, and I do not know what the experience of a trans or trans non-binary person, a transgender person, what their experience would be like. But as other individuals on different locations of the gender spectrum, I'm just very curious about how other people feel going through this process, and if it affects their feelings about their gender or identity as well. And for me, the levels of pink and flowers and Susan G. Komen ribbons caused more unnecessary suffering, more pain and isolation, and a very terrifying experience. The study is an exploration in expressing and naming the internal experiences of these cancer patients, as well as processing of the treatment. And by treatment, I mean both the medical procedures themselves and medications, and also the treatment or interactions with medical professionals and other people in the patient's lives, so how other people treated them. So obviously I have a lot of personal feelings around this topic. That's a picture of me at home between chemotherapy sessions, my cat, Percy. So throughout this process, I will engage in my own contemplative, reflective writing to get more insight and a more expansive view from an autoethnographic perspective. And so, some background on this topic. There's not a lot of research regarding transgender and gender diverse breast chest cancer patients, or any cancer patients that are non-cisgender. In general, people can feel really unseen in this population. Things are not welcoming or accommodating. People can get misgendered or dead named in medical settings or asked inappropriate questions. Misgendering and dead naming is particularly risky if done like in a waiting room around lots of other people. So that can put people at risk from, kind of outing them in front of who knows who in the waiting room. Transgender, gender diverse people have worse outcomes and prognosis because they may have had a negative medical experience in the past, violations of their dignity, which keeps them from going to the doctor and getting checked out in a timely manner, or maybe even showing up for medical treatments. In addition, medical professionals oftentimes are not listening to concerns from transgender, gender diverse patients or taking them seriously. Obviously, if you have other addressing factors, such as if you're a Black, Indigenous, or person of color, you're going to have even more of these compounding issues with treatment from the medical realm. And transphobia. So yeah, there's transphobia. Also, transgender people are statistically less likely to have insurance, so there's also accessibility concerns there. One of the most common forms of, this is an interesting fact, but one of the most common forms of breast chest cancer is hormone receptor positive. There's like 70 to 80%. That's what I had. It means that the cancer cells use hormones like estrogen to grow. So there's also this effect called aromatization, which is a biochemical process within your body where androgens like testosterone are converted into estrogen. So long story short, because of this, an oncologist may actually ask a patient to stop their gender affirming or harmonizing care, such as hormone therapy, which could put them at risk for gender dysphoria, which leads to several other negative mental health outcomes like increased suicidality. So this puts a patient in a place where they feel like they have to choose between like fighting the cancer or like living their authentic self. So that's a really painful position. That could be a very painful place to be in. Additionally, family members or acquaintances may say insensitive, asinine comments, like, for example, oh, well, at least you'll get free top surgery. I've heard of that being said to people that I know, so it can happen. Also, like I mentioned, the breast cancer is associated with all things feminine, pink, flowery, though cis women and female identified people are not only the only ones who get breast chest cancer. Susan G. Komen, Pink Ribbon, it's all highly gendered, curated public image. Then there's Breast Cancer Awareness Month, where there's packages at the grocery store and everything you look at is wrapped in pink. Workplaces do Breast Cancer Awareness Month campaigns, and all that kind of stuff can be very, very challenging. I'm reminded of a time when I was trying to go back to work after treatment, and it happened to be Breast Cancer Awareness Month, and my work put up this big pink bulletin board and encouraged people to write notes about people who they know or knew who had breast cancer. And I found it to be very activating. It seems like a lot of what is done around breast cancer as far as like visually, what's out there is actually mostly for the people who know people with breast cancer, as opposed to the actual cancer patients or survivors. But so really quick, oh yeah, I also wanted to mention that the title of my presentation is from a really good article in the literature. It's in the reference page at the end. That's a really good study on gender diverse patients and medical settings and cancer. But ultimately with this study, why it's important is like my interest is in making cultural and institutional changes that can reduce unnecessary suffering in the cancer experience. My methodology, so my population is transgender, gender diverse chest cancer patients who are at least a year out from diagnosis, any stage of cancer or in any stage of treatment, who are 18 to 45 years old at diagnosis. This usually qualifies them as an adolescent young adult cancer patient. I know that seems like an old age range to be considered a young adult, but it's young for getting cancer. So actually, after reading other cohort mates' methodologies, I decided to change my methodology from a purely phenomenological to a mixed methods approach. And the reason for this is added visibility and objective measurability for this population, giving it hopefully a broader application for future work and more acknowledgement in that way for people that think that way, as far as objective numbers and such like that, things like that. It's very late. My mixed methods approach will include a survey combined with an IPA, interpretive phenomenological analysis based interview, which is popular in studies that involve medical topics. And this is, according to Bagger, Charleston, and McBeath. It looks at how participants are making sense of their personal and social world, which is perfect for what I'm curious about. So my goal is to acknowledge my natural attitude to the phenomenon while keeping a beginner's mind and caring attitude, attuning to and centering the experiences of others, and remaining open, or probably more accurately, repeatedly opening to the mystery. And a tool I will be using for this is daily reflective writing and an arts practice. So there will be pre-design involved with the development of the survey, which will involve my clarifying what data to ask about, as well as figuring out the number of participants. Once these items are determined, the development of the questions will be my priority. The design test and finalizing of the survey alone will probably take around 2 weeks at least. I don't know, it could take more. But I'm just estimating the survey will ask multiple questions, multiple choice, and like Likert scale questions around gender identity, cancer diagnosis, and cancer-related experiences. I plan to reach out to several online cancer support communities to find potential participants for the survey. It would be ideal to find, 200 or 300, since this is a mixed methods study, but this might not be possible. But I would like to find as many people as I can, including those outside of California, if that's okay. And the survey would be administered online. Following the survey, there would be a selection process to find 10 to 12 individuals who are available for an interview, and 3-hour focus groups. So first, the 30-minute one-on-one in-depth IPA interview will be conducted with open-ended, unstructured questions, starting broad and getting more and more specific. At this time, I will also be discussing confidentiality, anonymity, safety, and boundaries. process, process consent, and the option to opt out at any point. I don't know how I'm going to fit that all in 30 minutes. That's something I got to think about there. At the interview, I will also give participants a gift card and a special enamel pendant / pin, so it can be worn either way, and it's going to have an image on it that combines like an acknowledgement of resilience through cancer, connectedness through the study, and celebrates gender diversity, acknowledging the contribution they already made with their survey and the interview. Following the interview would be 3 focus groups, each dealing with a sub-question. Each one will be 3 hours long and consist of a warm-in, individual EXA activity, group EXA activity, and discussion and theme exploration. Focus groups will be held virtually via a secure telehealth for greater accessibility, people in different stages and different mobility and energy levels. So I think online is very important. So the first focus group will be participant voiced poetry, followed by a group word cloud online. Focus group 2 will be visual art, and then a group virtual sandbox or Canva whiteboard. Focus group 3 will be movement and sound based, and then together create a group song tapestry, which we did with Stacey Yeldell's class. Just a reminder that, this is all going to be also, I'm going to be also working on myself constantly with daily reflective writing, and art as a means of researcher self-care and self-awareness, conversing with the mystery and doing all that reopening. I will conceptualize my analysis as having multiple altitudes as described by Barton in Badger, Charleston, and McBeath. I think I'm running out of time, but basically like seeing the overarching themes as like the bird's eye view, and that could be like what I come up with my analysis. The ground level would be like the actual words or images that came from participants, and then overarching themes would be zoomed out even further than that. And my goal would be to to submit my findings. Oh yes, also if there was any ambiguity, I'd want to, keep in contact with participants and get clarification. So my goal in submitting my findings would be to submit my findings to journals, create and publish a video online as well, which I'm hoping I could submit to film festivals and galleries, and also put it up in clinics and queer spaces or medical spaces. And in doing that video, my goal is a necessity is that I will need to find ways to abstract and keep the anonymity of the participants, of course. And then I also want to have a part in it that's like the experience of the researcher, like set in a separate place, but showing the narrative of the process and the findings in the 3 different altitudes in the creative art and video format. So here's my timeline really briefly here. So estimating 12 months, excuse me. So phase 1 is the production and the design, so that's like for even starting. Phase 2 is like the recruitment and getting like approval for the ethical elements of it. Phase 3 would be the survey, data, the data collection for the survey, and then the next phase is the IPA interviews, and then the focus group analysis, and then the journal submission and video, which I don't know, that'd be like the quickest edited video ever, so probably not quite 2 months, but this is a fantasy kind of. So So yeah, in conclusion, this mixed methods study will explore the diverse experience of breast chest cancer survivorship for transgender and gender diverse adolescent young adult patients with understanding and compassion. And it's my hope that results may inform a more inclusive and safer oncological environment. Here are some of my references, and thank you so much.